So the appearance of Japanese encephalitis virus in Australia has come at about the same time as the most recent report from the Intergovernmental Panel on Climate Change, IPCC. The report has looked at lots of aspects of climate change, but a key one was its effects on health. And the lead author of the chapter dealing with health was Professor Catherine Bowen from the University of Melbourne, who's here right now. Hi, Catherine.
Hi, Tegan.
So the past few years, it feels like the discourse about the health effects of climate change has been very much like we have to prepare for this future. But what we're really seeing is it's happening here now.
Yeah, that's absolutely right. So we are already seeing the impacts of climate change on human health. So we're seeing these, you'll have to excuse me, I'm recovering from COVID at the moment, so I've got a bit of a sore throat. But we're seeing these impacts what we call directly. So these might be from extreme weather events, whether these be floods or cyclones in Australia. And we obviously, the projections of these sorts of extreme weather events are for them to increase in their intensity and their frequency. So if we look at the direct impacts from floods, for example, these can both be death and illness from floods, very sadly, but they can also be what we call indirect. And so the indirect health effects are things like when we see the destruction of crops and this results in impacts on economics and the ability for families to, spend in ways that they need to, and also that has an impact on human health as well. But what we're also seeing is and the report identified this as one of the emerging issues are the mental health impacts of climate change. And again, these can be directly related to an extreme weather event, but also can be sort of longer term and more insidious, I suppose. So if we think about the long-term drought and drying we had in the early 2000s, there's been a lot of research that looked into the long-term health, mental health impacts of that, particularly on farmers in the Australian context. So when we try and understand the health impacts of climate change, it's really important to look at those direct impacts that we often hear a lot about in the news, but also these more indirect impacts. And these are the ones that are a little bit harder to start to assess and understand fully to get the bigger picture.
It's a really complex web, isn't it? You've got, like you say, the immediate things, but then there's also this sense of compounding of issues that perhaps people who already have poor security, food security or water security, it gets worse for them, or regions that are sort of dealt a few different climate disasters season on season.
That's right. And the IPCC assessment this time identified this issue around compounding and cascading risks and impacts for the first time. So if we consider the Australian context again, in 2019 we had one of the driest years on record. This was followed by the terrible Black Summer fires. And then in many parts of southern Australia, we also had floods in the first half of 2020. So this is what we talk about in terms of the cascading impacts of these sorts of extreme weather events. And overlaid on all that as well is the pandemic, and that obviously has impacts on our health systems and our health systems' ability to respond and recover as well. So this is a particularly sort of worrying because we do expect these extreme weather events to increase with further global warming. So that's right, having a good understanding of how all of these impacts interplay with one another, particularly, as you say, when we talk about understanding food and water security and the complex interplay across all these issues with human health outcomes.
We've heard about this sense of one health, that the environmental health, the health of nature and the health of societies is kind of interlinked. And we kind of heard about that in the previous interview about Japanese encephalitis virus. What sort of, have you looked at whether these things like arthropod-borne diseases are going to be more prevalent during climate change?
So the report really, for the first time, did clearly indicate complex and intricate links between humans, the environment, the natural environment we live in, and society. So it's really important that we do have that integrated way of understanding what the challenges are. And as you say, these are going to be many and diverse. So ranging from vector-borne disease changes in their distribution, for example, in Australia and elsewhere, but also if we refer to the extreme weather events again, then we know that these are going to increase in their intensity and their frequency. So what types of impacts will this have on not just our human health, but our societies and also our natural environments? And so this report really drew out that the importance of recognising, the well-being and the health of ecosystems is fundamental to our own human health.
What does Australia need to be doing?
Well, the report really talks about some key enablers in terms of how we do develop our, solutions and responses to climate change. And some of the key enablers that the report has identified include political commitment. And so for many countries around the world, this is a key issue in terms of appropriate and urgent action on climate change. So political commitment really was, again, for the first time, this report has really called out a number of new issues. Political commitment was identified as a key enabling factor in order for us to rapidly shift to the transformations that we need in order to be able to respond to the health, not just the health impacts of climate change, but all the other impacts around climate change as well. And the action needs to occur this decade. And the report also identifies that there are limits to adaptation. And so without rapid reductions in greenhouse gas emissions, we will come across these limits and there'll be nothing else we can do in many cases around adaptation. So the importance, the report also talks about the importance of linking adaptation and mitigation together. Yeah.
Adaptation and mitigation. Catherine, thanks so much for joining us.
Many thanks. Thanks, Tegan.
Catherine Bowen is a Professor of Environment, Climate and Global Health at the Melbourne School of Population Health and Deputy Director of Melbourne Climate Futures at the University of Melbourne and lead author on the IPCC report chapter Human Health and Wellbeing and the Changing Structure of Communities.